Hello, everybody. So thank you so much, everyone. Good morning, good afternoon, and good evening from wherever you are joining in our today's webinar. This is the first ever webinar of Nursing Now Challengers Committee, and this is organized by Eastern Mediterranean Regional Hub Committee. My name is Sana Gul. I'm from Pakistan. Currently, I'm working as a community health nurse and look after the digital health projects in remote areas of Pakistan. Along with me, we have Dalia Sroji. Dalia is from Lebanon, a nurse working in currently USA. She will be moderating today's webinar along with me. And we have a great panel of speakers today to join our webinar. The session is on very important topic. During this session, we will be discussing the role of advanced nurse practitioners in low and middle income countries. We will also discuss the ways in which the advanced nurse practitioner role can help low and middle income countries to achieve the universal healthcare coverage and other related sustainable developmental goals. So formally beginning, we have 31 participants right now, and I would like to thank all the audience again for taking out the time, doing the registration and attending today's webinar. We feel like this is very important for the nurses to voice out the need of the nurses and the impact that nurses can make to achieve the universal healthcare coverage and SDGs, especially in low middle income countries, and also to connect with nurse practitioners from developed countries and to learn from their experiences and how can we strategically replicate the nursing roles from developed countries to low and middle income countries and achieve the universal healthcare coverage. I feel like the nursing leadership globally can play a huge role to connect nurses from low middle income countries. The nurses from low middle income countries to connect strategically, globally, in policy level and at leadership level to implement and voice out the need of the nursing leadership and nurse educators and advanced nurse practitioners. I would like to open the floor now for our speakers. I feel like we have audiences from all around the globe, and we can see in the chat people coming and introducing themselves from Bhutan, from Kenya, from Pakistan. This is lovely to see everybody here. And I would like to now welcome and open the floor for our speakers. We have a very talented, experienced and nurse leaders panel of speakers today. Dr. Michelle Acorn, Dr. Deborah, and Dr. Daniela will be joining us as keynote speakers for our today's webinar. Now, I would like Dr. Michelle, you to introduce yourself, and then Dr. Deborah and Dr. Daniela. After your introduction, I would like you to talk on the role of APNs, why it is important, and what impact it can make in the healthcare system, especially helping in achieving the universal healthcare coverage in low and middle income countries. What are the learnings from developed nations, and what learnings we can implement in the low middle income countries? Thank you so much. Over to you, Dr. Michelle.
Thank you, Sana. Great to see everybody, and happy Tuesday. If you can put up the slides while we introduce each other, that would be great as well, because time is of essence and we have a lot to cover. Greetings to all our challengers, and thank you again for the invitation to Hannah and team. I am a chief nurse. I am in executive practice, but what you may not know about is I actually do clinical practice as well. I have been a nurse practitioner, emergency, hospice, internal medicine, geriatrics, and I led the first nurse practitioner-led hospital as most responsible provider. Before I get into the introductions, I'll bounce over to Deborah. Deb, sorry, that was formal.
Hi, everybody. My name is Deb Gray, Dr. Deb Gray. I'm from the U.S. I'm also an advanced practice nurse, nurse practitioner for 32 years now, and I oversee 10 advanced practice master's and doctoral programs. I'm also the deputy director of the Icn NP Advanced Practice Network Global Academy for Research and Enterprise. And I also practice.
Daniela?
Thank you, Deb. Yes, my name is Daniela Lewald. I'm the chair of the Icn NP and APN Network. And that's in a voluntary capacity in my day job. I'm an academic lead in nursing in Dublin City University in Ireland. And I have former experience as a nurse practitioner in cardiothoracic surgery. And I am currently involved in chairing the master's program for healthcare and nursing practice in the university that I'm working in. So I'm involved in developing courses for advanced practice nurses, and I'm involved with the network for a long time.
Thanks, Daniela. And next slide. So I'm a primary healthcare and an adult and a doctor of nurse practitioner. Right now, I'm in independent practice, by the way, looking after youth that are in conflict with the justice system, as well as we opened the first residential treatment care trauma-informed for human trafficked women in Canada. I practice in Ontario, by the way. So let's get busy. I have a challenge for you. That's why we're here today. I have a quadruple advanced practice nursing call to action challenge for you. First, join the Icn Apn NP network that we're going to highlight for you. Secondly, leverage your Icn Apn guidance resources that we will highlight at a very high level. Third, submit all your abstracts and attend and meet us in Dublin in August for the conference. And lastly, maximize your value as an advanced practice nurse to invest and enable to really achieve this sustainable developmental goals and universal health coverage, because nurse practitioners really are about that. And let's move to the next slide. If we're going to meet the sustainable development goals by 2030, primary care immunization, for example, are important across the lifespan, across all sectors and all countries. Icn has taken a leadership role. We have over 130 national nursing associations, 28 million nurses, and we're the first non-governmental organization recognized by the WHO. And we're leveraging the collective power of our Nursing Now groups. Next slide, please. You need to be local, think local, act local, and be global. Be aware of the global strategic directions for nursing and midwifery and the why of the 4 pillars for advanced practice. Under education, we want to make sure we have a competent and confident workforce that's able to meet the service delivery needs for primary care across the lifespan and our population health. We want to have jobs, not just jobs, meaningful advanced practice careers that are able to optimize our full scope of practice and contributions to our nation. And as early generation or leadership across, whether it's frontline and the executive suites, as a bureaucrat, whatever it may be, we need to be leaders to advance and influence that impact as well. Next slide, please. I talked about the universal sustainable development goals, but if COVID has not taught us anything, as we are still responding, as we're trying to recover, and as we have the opportunity to rebuild, we have to think about addressing the primary health care gaps, the significant health human resource shortages of 13 million that was highlighted in the Sustain and Retain report, and obviously patient safety, but also our health workforce safety, and truly being holistic in our approach. Next slide, please. I encourage you to look on our website at this report. If you have not looked at this, this is a Sentinel report, and we're here about low and middle income countries as well. And this is the Eastern, Central, and Southern African region education and labor market. This is important. Look at the partners that are a part of this. It's the World Bank, for example, JPEGO, Icn, of course, and Icn, which is the College of Nursing and Regulation. The World Bank is the largest source of funding. If we're going to think about investing in nurses, we need to actually know the power of our education and our service delivery. And more importantly, let's not just read the recommendations, let's actually act on the recommendations. Next slide, please. My top 3 takeaways from this is our why. Our why globally is more than 80% of our population in low and income countries can't get access to services. Nurses are central to achieving universal health coverage, and we know our nursing workforce is insufficient to achieve this right now. And we need to be the drivers, utilize our professional power and maintain momentum to truly sustain what we want to do. Next slide, please. If you look at the recommendations, this is very powerful. We need to think about, as nurses, how we invest and understand money and the value of our nursing profession and how we meet population health. It's not just jobs, as I mentioned. If you think about the benefits of investing in nursing, which is investing in improving health outcomes, the return on investment is significant to the tune of the global standard of a value of a life saved of $50,000 with one nurse that's produced, especially in low and middle income countries, could result in a benefit of a life saved in about $10,000 to $12,000. Money matters, people matter, health matters. Next slide, please. Advanced practice nurses are actually solutions for health. And the recommendations in this Icn report actually talks about regional curriculum frameworks for education. What is important is to understand the role clarity, the role overlap and synergy between a registered nurse, for example, an advanced practice nurse, and how we're utilizing and advancing education, including masters and bridging programs as well. The other key thing you need to understand that's sentinel to advanced practice, and more importantly to advanced practice, is understanding the quads. The quads have a leadership role that you must engage with in partnerships for regulators, educators, nursing associations, government chief nursing officers, and etc. Know your partners, engage your partners, and build the relationships. Next slide, please. Remember my 2 challenges: review the advanced practice nurse anesthesia guidelines, as well as the prescriptive authority guidelines. Next slide, please. If you haven't looked at the Springer series, we have an advanced practice series. If you use the ICN code ICN 2021, you'll get a 20% discount, and you will see that we have global perspectives here, role transition, clinical nurse specialists, and introduction to advanced nursing practice, and a lot more things that are in the pipeline that we're working diligently on. I'm a master of time. I'm punting now over to Deb.
And actually, if you could just advance to the next slide, I think we can just keep going. There we go. Again, thank you all for the opportunity to speak this morning. I've been asked to speak a little bit about, could you go back just a little bit? Sorry. I've been asked to speak about some of the initiatives going on in Africa. And I think, as Michelle said, we know that healthcare is a huge problem around the world, and it's especially acute in Africa, where 85% of the countries have a majority, in 85% of the countries, the majority of the population has little to no access to health services. And there's a shortage of primary care and other workforce, and that's the primary reason for it. Nurses are already comprise the largest cadre of existing healthcare workforce around the world, including Africa. And nurses, especially in Africa, are the most distributed, especially in terms of underserved and rural regions, and already provide a lot of the healthcare in those regions. But we need more nurses educated with advanced practice education and skills to assess, to diagnose, to treat illnesses, and provide other services in order to implement the priorities in the global strategic directives for nursing and midwifery, to really be able to contribute to universal health care and the population health goals. Next slide, please. So I actually had the opportunity to spend a year in Africa, in Botswana, as a Fulbright scholar. So, and Botswana is kind of a model that for Africa in terms of advanced practice nursing, and also the initiatives I'm going to speak to are related to Botswana. So I just want to give you a little background. It's a largely rural country with only 2 million inhabitants, and there's been a long-standing shortage of physicians in Botswana. So Botswana has taken the initiative to integrate advanced practice nursing education and really sought to increase the numbers of advanced practice nurses providing care. And they've actually been doing this since 1981. Some of the first programs were started then at the post-diploma level, and now it's at a master's level for licensing. Now, advanced practice nurses in Botswana are nurse specialists, and they are licensed as family nurse practitioners, as well as clinical nurse specialists in a lot of different specialties. And the University of Botswana is kind of the flagship institution that really only offers the master's degree advanced specialist programs in Botswana and for much of Southern Africa. Next slide, please. So the two initiatives I just want to touch on today, just briefly, one is started through the World Health Organization Collaboration Center for Nursing and Midwifery in Botswana with colleagues in care and the World Hypertension Action Group, and that's the Blood Pressure Specialist Program. The other is an ICN program, the Icn Africa Advanced Practice Implementation Project. Next slide, please. So the blood pressure specialist program is more a model. It is a program for advanced practice primary care nurses, midwives, and hospital nurse specialists. And the way that we did it was it's actually a train the trainers. So the people that came to this were expected to go and train people at their facilities in cardiovascular and particularly hypertension management. And the program highlighted the burden, went over new research, guidelines on hypertension medical management and lifestyle changes, how to teach correct blood pressure monitoring, as well as community mobilization and education. Next slide, please. So it was a training program that was actually quite successful. We had nurses from all over Botswana come, take the information back to their facilities, and we're looking at hopefully implementing it, similar programs based on this model in Tanzania as well as Ghana. Both countries have shown interest in it. The other initiative I'd just like to briefly touch on is the Icn Africa Family Nurse Practitioner Advanced Practice Implementation Project. It's still in the very early stages, but we're looking at developing nurse practitioner and advanced practice nursing, similar to what's going on in Botswana, in countries across Africa to provide primary care and primary prevention. So thank you, and I'm going to pass it over to Dr. Lewald.
Thank you very much, Deb and Michelle. I'm going to come back, next slide, please. I'm going to come back to the point one that Michelle was making, join the Icn Apn Network. And I'm just posting in the chat the link to the free registration. So do feel free to sign up. This is a free network, and we would be very happy to have any of you joining us as a network member. We have launched the network already in 2000, and it's been going strong. You can see there on the map in the right bottom corner that all the areas that are highlighted in red at the moment, we have some members within the network. And as you may know, advanced practice nursing started to develop in the English-speaking countries first, with the United States of America, Canada, Australia, New Zealand, UK, and Ireland, and has now spread globally, but it's slightly different to what we know in nursing in general. Nursing in general is available everywhere around the globe, but advanced practice nursing is still developing. So it depends on where you find yourself in the world. If advanced practice nursing is something that is well established, it has all the requirements that you need to practice and be regulated at that level, and I'll say something about that in a minute. And then depending on where you find yourself, maybe in another country in the world, it might actually be that advanced practice nursing is either not implemented yet, or there are parts of advanced practice nursing that are implemented and others are still developing. So it really depends. So we would love to have you on board. And the network consists of a co-steering group, which is kind of a management board. We have a global academy of research and enterprise, and you just heard from Deb about that. And we have 5 subgroups. We have education, practice, research, health policy, and students. Next slide, please. So within the network, our mission, I suppose, is to empower, connect, and promote advanced practice nurses globally through networking, policy development, advocacy, leadership, education, and research, with a vision to support the development of advanced practice nursing, who will provide holistic, accessible, high quality, evidence-based, and cost-effective health care. We are passionate people, as you hopefully hear already. We are collaborative, we work globally, we're evidence-based, and we are research and innovation focused within the network. Next slide, please. Here are just a couple of examples of current contributions that we're making within the network and through the global research on NP and APNs. There's the COVID-19 study into advanced practice nurses' emotional and spiritual well-being. I'm just mentioning a few here. There's SWOT analysis, competency mapping going on. You heard about the Anglo-Africa Coalition. We had an examination into advanced practice nurses' job satisfaction internationally, which we're actually going to collect again the data on that quite soon. We had a faculty mentoring project in Hungary, which might be interesting to yourselves, maybe where you might actually develop programs within your schools and universities to support advanced practice nursing. We had a survey on clinical education on APNs globally. Next slide, please. So just coming back to, I suppose, the map that we saw, where we saw that advanced practice nursing is at different stages of development, depending where you are in the world. And this is why we published the International Council of Nurses APN guidelines in 2020, and they help towards contributing to a common understanding of advanced practice nursing. So it gives you the definitions, and it kind of gives a good scaffold of what is needed to implement and sustain advanced practice nursing. It was an international effort between the network and ICN, 33 experts, or experts from 33 countries, I shall say, and the 130 national nurses associations connected to ICN. And the guidelines are available in English, French, Spanish, and are currently being translated into Japanese. Next slide, please. So within the guidelines, as I was saying, the definitions are something very important. You already hear now, I think in this webinar, that we're using different terms, and that's really important to be clear on that. So when we talk internationally about advanced practice nursing, that is an umbrella term that encompasses 2 main roles of advanced practice nursing. So they are clinical nurse specialists who are experts or providing expert clinical advice and care based on established diagnosis, so patients who already have a diagnosis in specialized clinical fields, along with a systems approach and practicing as a member within the healthcare team, and nurse practitioners who cross over between nursing and medicine. So they integrate clinical skills associated with nursing and medicine in order to assess, diagnose, and manage patients in many different healthcare settings. And they usually can provide a full episode of care without the physician being present. So that's a different level to clinical nurse specialists. Next slide, please. And the 3 pillars of advanced practice nursing. So in order to actually implement advanced practice nursing and to sustain it, more importantly, these 3 things are really majorly important, and refer to those in the guidelines if you want to have a closer look. So education beyond that of a generalist or specialist nurse. So the minimum requirement that we are suggesting is a master's degree in a specific course tailored towards advanced practice nursing. So it must teach the skills that are needed for advanced practice nursing. It is acknowledged, however, in the guidelines that we might that this goal might be quite aspirational in some countries, and that there might be bridging programs needed, as Michelle was mentioning earlier on already, and that's totally, absolutely fine, and that is acknowledged in the guidelines. Regulation is the second pillar. So advanced practice nurses need the authority to be able to diagnose, prescribe medications, order tests, have the authority to refer patients and refer to other services, admit, discharge patients, and also the title of advanced practice nurse, clinical nurse specialist, or nurse practitioner needs to be protected by regulation. And practice, of course, the most important part, I suppose, it is a practice-based role, and we said that already. These are nurses who don't want to be a manager or an educator. These are nurses who stay in direct patient care, but they practice beyond the level of a generalist or specialist nurse in an advanced practice nursing role. So they have an extended and broader range of autonomy in practice. They carry out decision-making, and as I said, they carry out episodes of care quite fully in most scenarios. So they are really important parts of advanced practice nursing to keep it sustainable. Next slide, please. And here are just some future contributions that so things that we are kind of still planning and still doing or continuing to do. We are the COVID-19 study into APN emotional and spiritual well-being. We're going to have a second phase on that, similar to the job satisfaction study. And the Africa APN Coalition is going on and going strong, which is brilliant. We have a review of the global APN research gaps, APN perceptions of spirituality globally. We're planning some webinars that should be coming up soon. So if you're a member, you will be hearing about those. Developing APN education CPD standards and updating the global APN rules and country profiles, which would be brilliant if we could get some from your countries, from the Eastern Mediterranean area. That would be really fantastic. Next slide, please. To keep in touch with us, I suppose once you're a member, you will get a bulletin twice a year from the network that looks like this on the left side, more or less. So you would get that kind of sent out to you in an online format. We have various social media links that are there on the right top. And also to mention, and Michelle mentioned that already, that's also part of the challenge, the Icn Apn Network conference on the 21st to the 24th of August in Dublin, in Ireland, and you're more than welcome to come to that. Just to say as well that we have special rates for low and middle income countries, so there are reduced rates available. And we also have 3 grants that we give away every time for the conference for 3 accepted abstracts who apply to have their travel and the registration supported from the network. So you can apply for that. That will come up on the website and you will see that, and you could apply for that. So just to say that as well. Next slide, please. And that's just from us, just to kind of, if you wanted to get in touch, there are some email addresses here. Deb's email is not on the slide. If you wanted Deb to put that into the chat, just in case if somebody wanted to get in touch, but you have all the other ones there. Melanie is the past chair, and I think she's sitting in the audience. So I'm sure she'd be happy to be contacted too. Thanks very much for your attention.
Great job. Thanks, Daniela. And my apologies, Deb, for your email. I think it was on the slide. Over to you, Sana.
Thank you so much, Michelle, Daniela, and Dr. Deb, for having this very comprehensive and informative presentation. Surely it was very new for us as well to know the impact of APNs in primary healthcare, especially, and the experiences from Botswana of blood pressure specialist nurses, and then of course about presenting the APN network of Icn. Thank you so much for this opportunity. Now moving forward, we are really short of time. Moving forward to our next speaker, Dr. Rafat Jan. Thank you so much, Dr. Rafat, for joining us today in this webinar. I would like you to please briefly introduce yourself and start your presentation on talking about the role of advocacy for the role of APNs in countries, especially in Pakistan, that the work you have been doing.
Can you hear me? Can you hear me?
Yes, we can.
Can you see my shared screen or no?
Yep, you're sharing your screen. It's really good.
Let me share the correct screen, so you know. Or Sana, can Hannah or somebody run that slide?
Hannah, could you?
Okay.
All right. Yes. Thank you.
Okay, thank you so much. Let me share from mostly Amro region where I have traveled. I'm Rakat Jan, and I'm currently Associate Dean and Professor in Outreach and Policy Unit at Aga Khan University. And I have been more inclined towards as a nurse midwife. And next slide, please. Today, I would like to share from Evro region, the guide from WHO for this regional development of nursing specialist practice team. And I put the red with my, it is not in WHO, but I put midwives as well. The guide describe about definition criteria for designating specialty. You have already heard from Icn colleagues title. Scope of practice is very important, and what was not in the document, that is the regulation. Importance of regulation, no one can deny, and you have heard about this. Next slide, please. So the WHO Amro region defined criteria that it should be in the, like what we heard, local, national geographic scope, because populations might be different, and the demand and need, which meets the priority of health needs of that country population, and whatever specialty we are bringing, so their purpose, function, standards, these are very, very important. We have heard the 3 pillars, and entry into the practice needs to be successful completion of academic program. And I must say that in my experience, I saw very, very low competency to high competency, and where we cannot see practice is we are not providing clinically competence-based program. And the knowledge and competency I've already discussed, and we have to maintain an advanced expertise. So in many Amro region countries, still the licenses are one, that is for general nursing. There is no separate license for advanced practice nurses or midwives. And then it is auto renewal of license, so maintenance of competency, and we need advanced expertise, so we need formal and informal learning experience. And then all these specialty needs to support through health system. I will talk later. Next, please. This is again defined in the WHO document, their different roles. In Amro region, we, like the world did, from diploma or BSN nurses, we still have many, many diploma prepared nurses whose role are extended. They are not called as a nurse practitioner, yet they are practicing many of the things like nurse practitioner. Then that is extended role. Then we have expanded role. Their scope of practice are higher. They work like nurse specialists, and they are also diploma and BSN prepared. And then we have those nurses who are master's prepared. They can serve as an advanced role. So these are the some of the roles have been listed in Amro region WHO document. Next, please. So regulation. This is very, very important in my experience, team. For regulation for protection of title, it is very, very important that our acts and laws must have title of nurse and definition of nurses. And then regulation comes from these acts. And yes, every country is very, very complex. So each country has different, that who is approving the act. Is it Parliament? Is it Senate? Or is it regulation with the body, which is actually accepted by all those country level legal bodies? Now, who is regulating education, practice, license, and certification? And still in many countries who are complex, I agree with you. Dr. Rogers, and journal nurses, councils or regulatory body are right now doing education, practice, and life. So what will be the criteria? That is very, very important. And in Dublin conference, one of my recommendations is EMRO region nurses and midwife leaders can meet, and we can come up with at least EMRO region some basic criteria, taking the guidelines from ICN, global criteria, what and how we would like to develop what kind of criteria. And one of the things, prescription authority, and that is extremely important, that this is a huge responsibility. Authority is one thing, but the responsibility of prescription is another thing. So because if we are newly starting this this kind of roles in EMRO region countries, then what kind of responsibility, and that will be very, very important. Next slide, please. I would like to share one case study. I am situated based in Pakistan. So in Pakistan, there is Karakoram, Hindu Kush, and Himalaya, these three high ranges of mountains. And this is called the world, the roof of the world, the most challenging and difficult situations here. There are extreme colds, there are avalanches, and you name it, they erase the villages. Although this is very, very scenic and tourist place, but look at if you look at the pictures, think about pregnant women, labor women, postnatal mothers, babies, or even elders, or any disability. It's one of the most difficult situations. Next slide, please. In pandemic, think about pandemic when two of my master's prepare students just completed their research, and they found out from the women, they find that women were highly isolated. There was no transportation available in these areas during the COVID time period, and the information was very, very difficult. And all the midwives, nurses, and lady health visitors were mainly running maternity setting in public and private sector, as well as they were running emergency response centers. Next, please. So in 1972, actually this role started from our Sun Health Service Pakistan. It is a private NGO, and they trained midwives initially in the city of Karachi, and they sent the girls or newly graduated midwife and lady health visitors in those areas. And now native midwives and nurses have been prepared in those areas. So they are very, very hardworking women. Next, please. Now, these are the family health centers in which one midwife, nurse, and one lady health visitors, they are assigned this kind of facilities. It has boundaries. It has small diagnostic facilities. They have a small pharmacy, and they have room to provide care. Mostly they started with the maternal and newborn and children health under 5. And now slowly they are moving towards the family nurse practitioner because the community demands are coming into that area. Next slide, please. These nurse midwives and midwives are very, very essential for these communities. They actually carry vaccinations, equipment, small and vaccines, and they go from home to home. Also, they provide antenatal, postnatal support, and also they provide other kind of advices and guidance if anyone is sick within the home facility. Next slide, please. So prior to COVID, almost everybody from the community used to come to these nurse midwives, and lady health visitors. Next slide, please. But once the COVID started, the good thing is that they have enough space, so they do screening of mothers and babies and other children outside these facilities in their own garden. And if you see from the picture, there's a boundary wall, which you can see. So these are the very safe family centers where women can provide care to another women or also families. Next slide, please. And when first I said these nurse midwives, they also provide school children health assessment. They give them health education, and they go. Their field teams go from one school to another school. But during the first surge, when schools were closed, they were providing their center. Next slide, please. Then there were the field hospitals where nurses' roles and midwives' role really expanded. And they came into the eyes of public and visibility. They used to do all kinds of diagnostic tests, including PCRs and other things. They used to provide care, and community appreciated. Government appreciated their role. So it's the public and private sector nurses who were doing, and midwives. So that's they were doing. Next, please. And they were doing home visits. I have already said that in the home visit, if mothers were not able to come due to surge, then they used to go at their home and they used to provide care. Next slide, please. So what were the challenges? As I have already said, that isolation, transportation, this thing. But government basically, initially the first surge came in disaster. They said stop all the services except essential services. Now, what happened in this elderly, disabled, or women and pregnant and lactating mother and other were missing. So the midwife and nurse leaders stood up and they said, 1 month is enough of the stopping. We can't stop anymore because we have to continue the vaccination, the antenatal checkup, the postnatal checkup, deliveries are happening at home, and we need all kinds of this kind of services to provide to the community. Next slide, please. And especially the women in blue, she is very strong advocate for community services. So she always come in front, no matter it's the earthquake, it's the avalanche, or whatever happened, she's the first one to stand. Next slide, please. One good thing I would like to share about this support. In this system, the midwives themselves are nurses themselves, they are young. When they deliver themselves there, the children are they're like newborn children. So they are allowed to keep either their sister or mother, one person with them, and their living facilities within that center. So then they can easily take care of the community. And you can see smiling nurse midwives, and those who are sitting at the back, they are their managers, but they always support their midwives so much, and they keep visiting them. So they are not called as such nurse or midwife practitioner, but their roles are like exactly like that. Next, please. So what lesson we have learned during the last 6 years? We really learned that the nurses, midwife, and lady health visitors were providing expanded roles. They learn how to negotiate and advocate for women, children, and communities. We were adopting guidelines from WHO or reading from Icn, and even still the national guidelines came, but most of the national guidelines came from WHO. What lessons were learned, and now we are still learning, that there are huge populations. Poverty is prevailing in Amno region countries. They are low economic, they are middle income, but also lower level of middle income. They cannot afford the care, and huge volumes are on the tertiary care. we need to demand this role. We need to advocate that role. And we need like to share and take the friendship sense of our ICN and other global nurses, and some kind of health insurance and reimbursement for universal health coverage to provide reimbursement of the services of nurses, midwife, and LHV is very, very important. If there won't be any reimbursement, then this will be lost cadre. We have already experienced some of these cadres during the low middle and very low middle income countries. And we also learned that if the nurses and midwife leaders are stronger, they provide lots and lots of strength, and they are the ones who can take these roles forward. Next slide, please. So we have to capitalize these new specialty extension and expansion of the roles. And we have to continuously serve our population. What we have to come up, I haven't wrote in this, but we need to form, like under the ICN umbrella, some kind of low and middle income, either AMRO, African region, Latin America is there together, how we can work for the future to help our population, how to develop new roles. And by the way, I personally know that when we were working on the act, when the word practice came, all the medical professions stand up and this practice is only for doctors, nurses, midwives can't practice, but they can become only specialists. So we have to educate them. And sometimes, you know, sometimes internal voice is not as strong, but outside voice are very, very important. So I would like to request my ICN and Nursing Now. I mean, I know Nursing Now was launched, but I would like to request, especially to ICN and this Nurse Practitioner Network, that think about choosing low and middle income countries in Asia and especially in South Asia for even a small regional conference. It is very, very important. And this will help and support from these countries, nurses and midwives, and support us. Next slide, please. So thank you. I would like to acknowledge all the nurses and midwives. And I would like to say that in many of our low and middle income countries, nurses and midwives are playing this role, but we have to learn whether the grandfathering policy and how to give them strong education, which should be competency based, to bring and channelize those experienced cadre in our country. So we have to learn every day. Thank you so much. Thanks a lot.
Thank you so much, Dr. Afajan. This was an amazing presentation with all the pictures. And we are really astonished to know that nurses and midwives are really working as practitioners in low middle income countries and already making an impact. It is only the recognition and the regulation that needs to be in place from government level. Thank you so much again. Now I would like to invite Dr. Mary Jane to please introduce yourself and speak on your role in USA as Advanced Nurse Practitioner. Over to you. Thank you.
Hi, everyone. Thank you for inviting me to speak today. I think the presentations are wonderful. The photos are wonderful, Dr. Jan and everyone else who spoke before me. And I think the work is wonderful. I am a nurse practitioner. I'm a lead nurse practitioner, the chief nurse practitioner on the acute pain service at a community hospital in Massachusetts in the United States. I've been in pain since, not literally, but in pain management since 2008. Prior to that, I was also in CT surgery, Daniela. Yeah, so I'm involved in a lot of policy making in the hospital, a lot of committee work in the hospital and outside of the hospital. I'm also the steering council co-chair of the Massachusetts Pain Initiative, and I'm involved in a lot of other initiatives. Will somebody be taking care of my slides? Okay, thank you. As this far along in the conversation, I will probably be reiterating a lot of what has already been said, but I will also talk about the impact of advanced nurse practitioners from my perspective as a nurse practitioner in pain management. Next slide, please. So, yep. So I just want all of you to take a look at this. Okay, next slide, please. So as you saw in the video, the population age is rising. That was in 2015. It's rising, even the numbers are even bigger now. And this is leading to an increased acuity of care. There is a continued shortage of physicians, and therefore efforts to search for innovations to strengthen the workforce are underway, as well as an interest in the impact of increasing the autonomy of nurses, assuming advanced practice roles in healthcare, and in particular, for the purpose of this talk, in LMICs. Next slide, please. So because I'm in pain management and that's my specialty, I just wanted to point out that chronic pain is a major public health problem. There are an estimated over 100 million Americans affected with chronic pain, or 1/3 of the people in the United States, and at least 20 to 30% in the world's population. In the United States, this is the primary reason for disability in Americans. Next slide, please. And the prevalence of persistent pain is expected to rise also as the incidence of diseases increase in the aging population in the US and in the world. And, of course, the diseases include diabetes, cardiovascular disorders, obesity, arthritis, and cancer. Next slide, please. So thank you, Daniela, for defining the different roles of the advanced practice nurse practitioners, because I don't think we all realize, even if we are advanced practice nurses, we don't realize what our counterparts do. So nurse practitioners do have a unique role in expanding access to care while still providing high quality pain management. NPs, unfortunately, are underutilized in today's dynamic healthcare environment and in strategic measures to achieve universal healthcare coverage and sustainable developmental goals. The ICN, and I think most of you know this, the ICN in a policy brief stated that globally, as we've heard, there is a high demand and interest in advanced practice nurses' roles, as they are an essential vehicle for innovation in healthcare. And this is just a quick NP fact sheet. There's a lot of facts here, but just to point out that there are more than 300,000 nurse practitioners licensed in the United States. We've been on average, nurse practitioners have been on average in the United States working for the past 11 years. When we first started off, we were in the number of 68,000, I think, in the early 2000s, up to this number right now. Next slide, please. And the distribution of NPs in their certification area, our family certification is the highest, followed by adult. And you may notice that the percentages are greater than 100% because some nurse practitioners do have more than one certification. And pain also is a certification here as well. And this is found on the AANP website. Next slide, please. So, like I said, nurse practitioners have been around for the past 11 years in the United States, but there's also a global interest in the development of the NP role, especially with the high income countries listed here, but also in the lower and middle income countries. They're looking to formally develop the APN role as a response to disparities in UHC, the disparities in the rich and poor communities. Next slide, please. So I think most of you already know this, I know Michelle does, and Deb, that according to the ICN, an ANP is one who integrates a nurse who integrates clinical skills associated with nursing medicine in order to assess, diagnose, and manage patients in primary healthcare settings and acute care populations, as well as ongoing care for populations with chronic illness. So the key is a nurse practitioner with the clinical skills, the critical thinking skills to assess and diagnose and manage patients. Next slide, please. So during COVID, advanced nurse practitioners had to step up. Well, state level governments in the United States suspended the requirement for advanced practice nurses to hold collaborative practice agreements with physicians. Massachusetts actually was the 23rd state to allow full practice authority so that NPs could practice independently without a supervising physician. And so this allowed clinicians to such as NPs, to perform at their highest level of their training and competency to respond accordingly to the crisis and the needs in the public. So for example, due to acute physician shortages during the pandemic and because of the high patient workloads, the NPs did step in to fill vital roles that were needed in healthcare. Next slide, please. So as the lead nurse practitioner of the acute pain service at a community hospital, I work as the consultant. So various services, various providers will consult with me to provide pain management. And it's very nice here at the hospital. The nice thing here is that the nurse practitioners are considered equal. I think in other places that are not so fortunate as I am, unfortunately, because the education is not there, the medical providers do not, they don't understand the role of the NP. They will sometimes talk down to them, but here it's equal and we're very well respected. And so I practice very independently, although I do have a supervising physician. And next slide, please. So I think we already know this, right? That nurses create the voices for patients and their families. The NPs, together with other nurses in healthcare, have been called upon to work in crisis situations to find innovative ways of delivering care while trying to manage the communication between different healthcare providers, the patients, and their families, and to help them navigate through difficult periods, through troubled populated areas. Next, please. Next slide. Again, to reiterate what has been said, the international policy reports have suggested that enhancing the nursing workforce will not only help to achieve the SDGs, in particular better health, greater gender equality, and stronger economies, but also help the world to realize high quality, cost-effective UHC. Next slide, please. Again, NPs are underutilized globally, but we have the potential to impact healthcare outcomes in our world's most undeserved areas. Next slide, please. Roughly 400 million people worldwide don't have access to basic and essential healthcare services, and about 58% of countries have less than 40 nurses and midwives per 10,000 people. Next slide, please. And although roughly 70 countries worldwide have established NP or APN roles, or are considering the introduction of these roles in their healthcare system, the monitoring and effectiveness of their utilization and contribution to patient outcomes is limited in some regions, particularly in LMICs. And although I've lived in the United States for most of my life, I was born in the Philippines. And so speaking to family and friends in the Philippines who are in healthcare, they say that the term advanced practice nurses, excuse me, what is that? It's almost non-existent in those areas. However, NPs have a key role to play in geographically isolated and disadvantaged areas, or GIDAs, in the Philippines and other LMICs. Achieving UHC and SDGs is a concerted effort, of course, but one of the problems is that most medical practitioners tend to gravitate toward urban areas. So we have to find a way to get our practitioners over to the more rural areas. And that's one of the problems in the Philippines. And that's where we can definitely use nurse practitioners. So my last slide. So action steps. Yes, policy and procedures, planning, regulations, all important, but we have to start with, I think, basic education. And it's not just education on how to educate the nurse practitioners, but we have to educate healthcare providers. We have to educate the public. I mean, in the United States still today, there are medical providers who don't even understand what the nurse practitioner role is. So I think there's a gap there that we have to fill. As NPs, we are prepared to deliver biopsychosocial, very holistic patient and community level care that incorporates expert knowledge of diagnosis, prescribing, treatment, and leadership strategies. Thank you.
Thank you so much, Mary Jane, for this wonderful talk. You actually concluded the overall the topic that speaking from your own experiences and moving towards the Philippine and other lower middle income countries where the trauma is still unknown, and then you were speaking that you are actually working independently in US, also highlighting why education is actually important to make everyone believe that what nurses can do. So before educating for the role itself, we need to work on establishing good quality education for APN where they would be trusted to practice independently. Then again, in low middle income countries, how like Dr. Rafat already mentioned that there are nurses and midwives who are actually in practice but not recognized. So these all things actually need recognition and proper strategic development and then implementation. Thank you so much for your time, for coming here and speaking and sharing your experiences. Now I would be handing the platform to Dalia, the co-chair of Eastern Mediterranean region. She would be moderating the panel, then of course the closing remarks. Over to you, Dalia. Thank you so much.
Hi, thank you all for having me here today. My name is Dalia Sruji. I'm a registered nurse and the co-chair in the Eastern Mediterranean Regional Challengers Committee. And I'd like to, because we're a little bit short on time, I'd just like to start by introducing the panelists that are from the Eastern Mediterranean Challengers Committee, because we're very proud of what we do. We're very proud of their work. First, we have Mr. Muhammad Ali Bdair. He is a BSN, MSN nurse who worked in the ER in Clemenceau Medical Center in Lebanon in 2021. And he has and he's currently a recovery unit charge nurse in Al Musa Specialist Hospital in Saudi Arabia. Thank you for joining this panel and being with us here today, Muhammad Ali. I'd also like to introduce Ms. Zaib Manasia Karim, who is a BSN peri-op nursing nurse who has an MBA in business management studies and is in a current assistant management position for allied health programs in a tertiary private hospital in Pakistan. Her passions include an interest in nursing innovation and entrepreneurship inspired by Johnson & Johnson nursing innovation. Thank you so much for being here with us. So I'm gonna start by asking one of the first questions of this panel discussion. And also, before we go any further, I'd like to encourage members of the audience, please, any questions that you have to any of our panelists, we would welcome them. We want as much interaction as possible. So yes, the first question is going to be directed at Mr. Muhammad Ali Bdair. And that question is, what are your current views as an early career nurse on the role of an advanced practice nurse?
Thank you, Dalia, for this opportunity to actually share my opinion, share the opinion of all the nurses in our region. First of all, I just wanted to back up what Ms. Mary Jane said about the because the actual problem is that some or most of the nurses here don't know what actually APN is. And this is actually a problem. I hope that this presentation can shed the light on the role and the importance of APN. In my viewpoint, the APN role is very important because it helps, first of all, it gives autonomy for the nurses around the world working in healthcare, and of course, it markets the nursing profession. Because in the end, at an administrative point of view, you really want to retain your nurses. You really want to retain your brilliant nurses, and you want to your healthcare approach to be efficient. Therefore, having advanced practice nurses will help as a checkpoint for the bedside nurses, will help as coaching and educating the bedside nurses, and will encourage the bedside nurses to continue with their education, to go on and make a difference in the healthcare. And because in the end, we want to have a share in the care plan of the patients, and we want the community around us to know what not just APN, how important it is, but nursing is important as well. And thank you so much for this time. And I thank you all the speakers for this informative presentation.
Thank you so much. And I'd also like to add to what you said. There's a lot of stigmatization around our profession currently in our regions. And really, through education, it's going to be the portal of change. I fully believe that. And thank you all for being here and supporting that idea. Zaib, on to you right now, Zaib Manasa. My current question to you is, do you think that advanced practice nursing in its full scope has the potential to improve healthcare in your country? And what is your country? If you'd like to touch on that.
Thank you, Daria, for the question, and thank you so much for the speaker, a wonderful presentation and information. The answer to this question is my country is Pakistan, and the answer to this question is very well descriptively in a story format is given by Dr. Rifat Jahan, that yes, we do need in a shout voice, yes, we do need APNs, and they will create a great impact in achieving preventive care, in achieving universal health coverage, in achieving shared workload in the hospital and healthcare umbrella. Like Dr. Rifat Jahan said, that most of the workload or most of the patient load has been diverted to a tertiary care, and we need to decrease that patient load and make it towards preventive medicine. And then we have a lack of data, so in this way we can gain more data than how nurse practitioner nurses are changing lives at the prevention level in the communities, and the people who cannot reach to tertiary care or secondary care, health care or hospitals or any healthcare facilities available in the urban area. So this role or these roles as a nurse practitioner in family medicine, maternal care and child health, or MCH, or in the remote areas, these can provide preventive care and medicines, so that when you are working at a prevention level, so you are decreasing the global burden of diseases and decreasing the workload or the patient load at the tertiary care level. So yes, of course, these APNs or nurse practitioners will create an impact in a full scope in my country and in the low middle income countries. Through the strong infrastructure for the policies and regulation and help and support from the regulatory bodies, monitoring and evaluation at how these nurse practitioners are working and promoting health education and awareness to the people. Thank you so much, everyone.
Thank you. And there's a current question right now from the audience. And the question is, and feel free, whoever would like to answer it, it's actually from Pakistan. The question is, how can we introduce the concept of advanced practice nursing in remote parts of Pakistan, where there is already a lack of healthcare facilities and people stigmatize the nursing profession more in comparison to doctors?
I think Dr. Rafat is the best person to answer this question.
Yes, Dr. Rafat.
just can you please repeat the question, because I'm trying to.
Yes, okay. So the question asked from the audience is, how can we introduce the concept of advanced practice nursing in remote parts of Pakistan, where there is already a lack of health facilities and people stigmatize the nursing profession more in comparison to doctors?
That's a very, very real question, I said, which we're facing every day. Like one of my colleagues presented from Massachusetts, she said that most of the disadvantaged and isolated areas need advanced nurse practitioners. We have already put through and working very, very hard first thing, the law to pass, and it has the title of nurse specialist, nurse practitioner, midwife practitioner. Now, we know there are a lot of hurdles, and as soon as this law will pass, the regulations will come. The second thing, as I suggested, it's high time that we have some kind of exclusive conference with our colleagues from ICN on advanced nurse practitioner, midwife practitioners, to bring our own policy makers, medical professionals, to make everybody aware what is happening globally as well as regionally. This is very, very important. On the other side, I think not only we, globally, I discussed with my friends, with other nurses, they all face some kind of issues or some kind of problems with medical profession, because doctors are, and communities, because doctors are easily acceptable. But let me assure, last 2 years, communities, nations, and global people learn that nurses and midwives are highly important. Believe it or not, I was in the field hospital in these areas. Doctors were so scared. Allied health professionals were so scared. They didn't want to go even visit COVID patients. Who were there at the bedside? Nurses, nurse midwives, and really, they were not scared. They were brave. They were coming in front of them. So we have already developed that movement. How we are carrying that movement? It's our competency-based education, communication competencies, understanding policies, and implementation and evaluation. Thank you so much.
Thank you so much for this wonderful note. And on this wonderful note, and I'd like to thank all the speakers for being here today. Your information was so important. As an early career nurse, as different early career nurses hearing this, it's so motivating to continue being and advancing our education in this profession and persevering and pushing. Because we're essential and the world needs us. They're gonna keep on needing us, and it's just wonderful. So again, I'd like to thank you all. Thank you, Dr. Michelle Acorn, Dr. Rifat Jan, Dr. Mary Jane Estrada Leiter, Dr. Deborah Grape, Dr. Daniela Lewald for being here. And I'd like to extend a special thank you also to the Nursing Now Challengers Committee, Mrs. Hannah Finch, Miss Andrea Latham, who sparked this conversation. And I hope we continue to have a lot of webinars and different kinds of conversations about these issues, because these are the kinds of issues that matter, that we need to be talking about and empowering other nurses to talk about as well. So thank you so much, and I hope everyone has a wonderful day, and we can repeat this at some point. Thank you so much.
Thank you.
Thank you very much. Bye-bye.